Association will host a live Zoom event featuring a Fairbanks student and faculty member from January through May. Each session will be recorded for those individuals who are interested in the topic we're going to be discussing but unable to attend. So with that being said, my name is Melissa Thomas. I'm a sophomore at Fairbanks studying community health. I'm also a student at the School of Liberal Arts, studying public and professional writing. Today, I have the fortune to be speaking with Tess Weathers, who serves as a research associate in the Department of Behavioral and Social Sciences. So Tess and I will be speaking about her research on the geographic patterns of life expectancy in Metro Indy and the upstream social predictors that drive a life expectancy gap between Indy communities. Throughout the event, please utilize the chat box below where you can type out questions for Tess or myself and initiate a conversation with other participants. We're hoping for a really great discussion, and we will be referring to questions at the halfway point and at the end of the session. I will also be asking Tess a few questions during those times, but we'll be monitoring audience questions and we will try to get to all of them. Just a few reminders about using Zoom, even though I'm sure we're all very familiar with Zoom. We have automatically turned off your microphone, and we would love to keep everyone muted unless you are speaking or asking questions. So we really appreciate you being able to connect virtually. And with that being said, I'm going to launch a virtual poll. And if you wouldn't mind taking your time, there are 3 questions, and then we'll go over the results really quickly together. So let's see. Could be out there. So there's just a few more, but I'm just gonna go ahead and share the results really quickly. I don't know if I can share the actual poll, but it looks like the majority of participants live within the Indianapolis metro area, and following that, about 30% live in Indiana. There's a pretty even split between urban and rural for the US residents that live longer. And it looks like for the 3rd question of the approximate size of the life expectancy gap between the longest and the shortest living zip codes, the most common answers were 7 and 14 years. So thank you so much to everybody for completing those polls. Oh, I'm sorry. Here, now I can share the results. There it is. Thank you for completing those polls. We really hope that it got you thinking. Keep an ear out during the presentation for any of the answers to these questions. And if at the end of the presentation you do still have questions about the polls or the answers to them, feel free to ask them at the Q&A part. So with that being said, let's get started. Please join me in welcoming Tess Weathers.
Hi, everybody. Thank you so much for joining us today and spending your lunch hour coming to learn a little bit about some work that I have been doing over the last several years, actually, but looking at the disparities in life expectancy that exist between communities in the Metro Indy area. And I just want to first thank Melissa, who is a lovely student I have in my class right now, for inviting me to come and do this with her. So thanks, Melissa. All right, so quickly what we're going to do today is I'm going to spend the first 10 minutes or so just giving you some results. What did we learn in our most recent updated analysis of life expectancy across the zip codes of the 11 county metro area? We'll have a short break for Q&A. And then we'll go back and get the other half of the question, which is what were the significant social factors that predicted life expectancy at the zip code level in Metro Indy? And then there'll still be a bit more time for us to engage in a few more questions. So I'm trying to recall what your polling results were. It seemed that most of you actually had grown up in the area. Was that right, Melissa?
It's about 40%.
About 40%. So we have the split of people who grew up in Metro Indy, some people who grew up elsewhere in the state or even in another state, as did I. And what I want to, the reason I like to know that is to sort of know how much do you feel like you consider this area home? How well do you know it? But, you know, it seems like by virtue of most of us who are joining here, we have some connection to this area, whether we grew up here or not. We feel like we're part of the same community. We share our weather. We share our local news. We know what people are talking about when they say, you know, I'm spending the afternoon at the track. But there's a lot of things about our daily experiences that are very, very different depending upon where you live. There are many things we don't share in common. Life in one neighborhood can be truly worlds apart from life in another, even when just a matter of blocks separate them. The air we breathe can be different, the safety of the streets, the food in the local store, definitely the quality of the schools. Children, however, all across the metro in any neighborhood have the same innate capacity for a long and healthy life. But the places where they're living and growing and learning often unfairly cut short their opportunities in their life. And these disparities in lifespan that we observe here in Indianapolis are replayed in other places around the country and the world to varying degrees. Often through the same upstream social drivers that we'll talk about in a bit. So, as I mentioned, there are other US metros that have found big differences among communities just a short drive or bike ride apart. This map that I'm projecting here on the right is a map of the Washington, D.C. metro area done in 2013. And it basically shows that people who live near the downtown center where the metro hub is have about a 7-year shorter lifespan than people who live kind of at in some of the suburban destinations of that metro. It was this map that really first got me curious about what was our situation here in Indianapolis. And so it was back in 2015 that we put out our first analysis of life expectancy here in the metro area. Looking at 104 zip codes across the 11 county area, we found a 14-year gap. As you go from the north end of the Monon Trail to the south end of the Monon Trail, ending kind of near downtown Indy. And, you know, seeing those results on a map where, you know, you could maybe find your own home address really kind of struck people in the gut a little bit. It brought home the issue of health inequity in a new way. And so we have had a lot of interest since that first report came out in repeating it and seeing where things stand. That's what I'm here today to talk with you about. What did we find when we repeated this? So we had another 5 years of data in our hands and wanted to go back and take another look at life expectancy across the metro to see what had changed. This work was in fact in progress when COVID hit. And at that point, you may go, okay, so she's talking about life expectancy going up to all the way up to the doorstep of COVID. Is it relevant to talk about life expectancy and social patterns stopping at COVID, given how much COVID has affected all of our lives? And I guess I would just argue that it has taken on even more relevance in the current social context. Though it's pretty rare in the history of the United States, we've now lost life expectancy twice just in the past decade. Deaths from COVID since 2020, along with a rise in deaths of despair, that includes suicide, drug and alcohol related deaths, will just deepen the pattern of health inequities that were already present before COVID. It was differences in the everyday conditions of life that placed Black and Hispanic persons at a greater risk of COVID and cut their life expectancy in 2020 at 2.5 times that of white persons. And so my overall statement here is that the same underlying social vulnerabilities that shortened lives during COVID were already shortening lives in the decades before COVID. And so it's important for us to look at these and try to take action to prevent that from continuing to happen in the future. So let's take just a step back for a moment. I don't know, some of you on this session probably are very, very familiar with life expectancy. Some of you may not be. You've probably heard the term being used a lot in the news over the last couple of years. Why so much about life expectancy? Well, it is a really good global number that can be compared from place to place around the world as a measure of population health. And not only health, but really how well that society is promoting the collective well-being of its members, how well it's creating the kinds of conditions that humans need to thrive. And when we compare life expectancy between places, it helps us to identify where those gains have not been realized and point out places for action, because we have also seen that life expectancy is something that is alterable by societal action. We have in fact seen massive worldwide changes in life expectancy from 1950 up to today, and public health is right there, as playing a big role in that, right? So with that somewhat lengthier introduction about this work, the big question is, what did we learn this time? What did the new analysis tell us? Well, unfortunately, we found that the gap had widened between our longest and shortest living communities by over 3 years. That's about a 23% increase. Here, we've plotted some places along the White River to just kind of demonstrate the gap within a patterning of life expectancy that actually plays out across the entire metro. And I'm wondering if you kind of like just look at the color patterning here, if you can kind of see where I'm going with this. On this map, the red bubbles mark places with low life expectancy, and the green are the higher ones. And what you'll see is that, let me get my laser pointer working here. We have this concentration of low life expectancy right here in the urban center. It's also bad as you get to the periphery of the metro. And then where you see the highest life expectancy is in these suburban transitions out of the city. Now, the shortest living community located in Indianapolis and the longest living community located in Fishers are just a 17-mile drive apart, with a gap of 17 years in life expectancy between them. So essentially, there is 1 year for every mile of distance between those two communities. Now on this map, life expectancy at birth for all 104 zip codes of the Indy Metro is shown for 2014 to 2018. The color coding represents quintiles, where all the zip codes have been ranked from lowest to highest by life expectancy, then separated into 5 equal groups of 20% each. So the red shading represents the 20% of zip codes where residents have the shortest predicted length of life. And the deepest green represents the 20% where residents have the longest predicted lifespan. And the same pattern we saw along the White River can be seen here as well, where life expectancy is lowest in places within the urban core and also on the outer periphery, while the highest life expectancy is found around the suburban transitions from the city. Now, if you're looking at this map for the first time, I'm pretty sure you're curious about your own zip code. I know when I do this work, that's the first thing I want to do is go find my own home. And while I haven't shown those labels on this map, I just want to point you to the online report where those labels are provided, and there's an appendix where you can look up the exact life expectancy value for both time periods in your own zip code. Now, one final bit of results that I'll share with you today. There's much more in the report than I can cover in our short time, but one other thing that I wanted to share with you, because it's not often shared, when you hear about life expectancy in the news, whether they say it or not, most often what they're reporting is life expectancy at birth, because then you're talking basically the average length of life from birth to death, right? And however, there's some value in looking at what life expectancy is if at other ages. So if I've already survived childhood, you know, if I've made it to the age of 25, how many years do I have predicted left to live? And this ends up being useful because it helps us know where the disparities are happening. If, for example, all of the gap was really related to infant mortality, we would expect that gap to go away by the time you get to adulthood. But what you can see here is that that gap does not go away. We never really outlive or outgrow this disparity in life expectancy that we see here in Metro Indy, because even though it is at its highest point at birth, it never gets smaller than it does at age 55. So this gap is fairly persistent across all ages of the lifespan. Now, having told you that this is a 17-year gap, and that's of course an average figure, you might be thinking, well, I don't know, is that big or small? Put this in some context for me, Tess. So I'm going to try to do that here. So you can see here that the gap between our lowest and highest in the metro area is 17 years. That gap is substantially wider than the gap between Indiana and the best US state, even though Indiana ranks poorly, down at 39th of the 50 states for life expectancy. That gap is also much larger than what exists between the US and the highest peer country, which happens to be Japan, in the world. This demonstrates what is possible for all people within our region, that we have communities in Metro Indy that are living as long as the highest wealthy country in the world. And yet we have some communities in the Metro Indy living only as long as countries that really fall into the developed world region of life expectancy. So what I am trying to do, and some others are trying to do, is say, let's try to shift our attention away from continuing to expand longevity and put the focus on increasing equity across people, bridging that gap between the 68 and the 85 among us. So that's the short results in terms of of what we learned so far, and then the next step we'll look into those social factors. But I'm going to break now for a little Q&A and hand it off to Melissa.
Yeah, if you have a question, please feel free to type it in the chat, or you can unmute and ask. In the meantime, in case you do need to think of a question, I'll just ask Tess a question really quick, if you don't mind. Yeah.
Sure.
So as you kind of mentioned, well, as someone who's not originally from Indy, when I moved here, I was surprised by the fact that you can drive a mile down from a really high quality neighborhood and see dilapidated housing, poor sidewalks, sometimes even within the same zip code. And so I was just wondering how when we're reporting life expectancy, how we can sort of account for those pocketed invisible neighborhoods who may still be within that zip code, but do not have the same resources perhaps as the surrounding area.
Yeah, that's a really good question, Melissa. Because what we have learned is that the more local you get, so as you go from looking at country differences to state differences to county differences to metro or zip code differences, the more closely you look, the more difference you will see, right? There can be very, very big differences, as I said, just even between streets, two neighborhoods that are almost kind of side to side. And, there has been, I think that's the beauty of trying to look more granular at the data. So what we have tried to do is continue to get smaller and smaller. There is a little bit of a challenge in that because, for example, this analysis is based on the actual record of deaths occurring among people living in these areas, and to get a sufficient count of deaths to base it on real data and not modeled estimates, which is what some people do. It is a little bit challenging, but I think it does point out our need to look very locally and to engage with communities who can help us see on the ground experience about what's happening in places, and who will have really great ideas about how you go about addressing under-resourced issues. So I don't know if that answers your question.
No, it does.
Okay.
I think, yeah, it's a very good point to make, because especially in Indy, as you do look closer and closer, these like disparities almost like overlap in a way. So yeah.
Right.
Does anyone else have any questions?
I think the one question that was in the poll that I didn't answer directly was the one about, do urban or rural areas have higher life expectancy? And I didn't directly answer that in my results. So I will tell you the answer is urban areas on the whole have higher life expectancy than rural areas. Now, this kind of gets to the point that Melissa was asking about small areas, because there are definitely pockets within the urban area that would on their own have much lower life expectancy. Areas of concentrated poverty, for example, are going to have a much lower life expectancy in urban areas than rural areas combined. But when you take urban areas on the whole and urban areas on the whole, urban areas live longer, and that's largely related to access to resources. We could go into a too long discussion about that, but yeah, and I'll just stop at that. And if anyone has more direct questions about that, we can bring that up later.
I can go ahead and ask another question, if that's okay. I have a lot lined up. I was just wondering, like, what has been the most challenging aspect for you about researching kind of the ongoing health disparities in Indianapolis, especially, I'm sure, as someone who lives here and truly cares about this issue. Kind of what concerns you the most when you are really like diving into this research?
Well, people who know me would know I'm pretty passionate about this. I mean, honestly, it just really, really upsets me. Um, and and I think seeing it, and realizing every single person, every single child deserves the best chance at health. And when you see on a map how differently that's playing out, and if we take the right actions, it doesn't have to be that way. But it's a big problem. It's a complicated problem, and it takes a whole lot of people working on it to fix it. It takes policy change. And so I'd say that's the hardest thing, is like really feeling strongly like it's an important thing for us to take on, but it being such a big and complicated issue, that it can be a little daunting. I guess that's more of a qualitative answer than a quantitative answer, but yeah.
I mean, like, given the complexity of like the issue itself, do you find a difference in communicating these results with a public health versus a non-public health audience?
Yeah, I mean, I think we've come a long way. When I first started doing this work, there wasn't, actually, it hasn't been that long where things like social determinants of health were not really even talked about. That's something that's kind of come about more so in recent years, and maybe the last 10 to 15, because you really have to go upstream. That's where what I'm about to talk about now. In order to tackle these kinds of inequities, you have to go upstream. That puts us back in time. It's not a simple problem. It's not writing a prescription. It's complicated. And so, yeah, that's probably the most difficult thing about it. And yet, I think in public health, and it's taking root beyond public health, the fact that all sectors of society have to come to this work. So,
I'm really
yeah.
surprised to hear that social determinants of health is kind of more of a newer thing, because
Yeah.
at least especially in my education at IUPUI, that's been such a overarching theme in like all
Mhm.
of the classes I've taken.
Mhm.
So yeah, it's definitely good that it's becoming more talked about, but I just am
Right.
very surprised that it's not, I guess, as widespread as I expected it to be, like as a student.
Yeah, I'm glad your perspective is that way. I know when I got my graduate degree, it wasn't that way. So
Yeah,
that shows progress, right?
right. And that
Yeah.
definitely means that more change can come.
Hmm.
Okay,
Exactly.
let's start the second round of polls. And now that I understand the polling thing, I'll be able to actually share the result. So there are three more questions again. Please take the time to answer them.
Looks like we're getting there. People are really thinking this through.
Yeah, they're hard questions. They're tough.
Just trying to pique your curiosity about this issue of place and health. So we're at 33 out of 40. We'll see if we get those last few stragglers in.
I think I will just go ahead and share the results.
Yeah, then you have to
Yeah.
end, if you click end poll, then you'll allow
Okay.
you to share it. There you go.
Okay, perfect. So it looks like the leading cause of death in the US that's expected by the audience is heart disease at 89%, which is followed by low educational attainment and smoking at 14%. Then for the second question, it looks like 83% believe that Indianapolis is more racially segregated than most of the largest cities. And finally, there's quite an even split between whether Los Angeles, New York City, or Indianapolis residents who are poor live the longest lives. Los Angeles is just in the front at 37%, Indianapolis at 34%, and then New York City is at 30%. And so Tess, before you start your presentation, we actually have one question that I really quickly wanted to ask because I think it kind of connects with the second part,
Okay.
which is what, if any, other demographics match up with your zip code life expectancy map, race / ethnicity, household income, etc.
Yeah, so that's a good cue up for the next part of the presentation. I'm not going to try to answer the question directly. I would say listen in and see if I answer that question. And if there are other parts of that question that I don't touch on in the next 15 minutes, come back during Q&A. Is that fair enough?
And if you have any questions about the polls as well, the answers that I just shared at the end, please feel free to ask them as well.
Okay, I'm going to close this poll out. All right, so now we'll pick up on the latter half of the presentation, where we're really going to hone in on the upstream social predictors of the life expectancy gap. So as I kind of mentioned, when we first did this, first published some life expectancy results back in 2015, people immediately began asking why, which is great. We should be asking why. The answer is complicated and it is a mix of things, but this time when we did the analysis, we dug a little deeper into the how and why by attempting to go upstream. For some reason my advancing is not working. There we go. Okay, so bear with me a little bit. I know I have a lot of public health people on the line today, and so this model you are probably very familiar with, but I'm going to talk you through it just because it's really crucial to me in terms of how we draw the connections between social factors and the life expectancy gap. So this is what we commonly refer to as the Barhigh model. But what it does is demonstrate how it is that health disparities happen. And as you can see here, life expectancy is as far downstream as it goes, because frankly, it pertains to death, the age at death. Living conditions, all these things right here in the middle, are the aspects of place that zip code represent. And then furthest upstream are the social and institutional inequities that impact our living conditions. So you see this gap in life expectancy is just the final manifestation of a long chain of gaps. Gaps in educational quality or opportunity, gaps in home ownership, poor working conditions or lack of livable wages, gaps in wealth, food, transportation access, and on and on. And then in a society that sorts people based on class and race, among other things, some groups are living in places where the resources they need for community well-being are systematically constrained. And that just perpetuates this health gap. We cannot move toward health equity without taking the work then upstream from its past focus on healthcare and disease to these living conditions and social inequities that drive the life expectancy gap. So with that sort of framework in mind, in our analysis, we focused our attention on the leading social causes of death identified by Sandro Galea and colleagues in a nationally published study back in 2011. Combining data from 47 studies, they identified these social causes, these top social causes of death, as accounting for a similar number of deaths as those that are in those disease-based lists that you've seen more commonly. Most of you did say heart disease, and I would argue it depends on how you ask it. If you ask Sandro Galea what is the leading cause of death, he would say low education, okay? So it depends on how you ask the question, and it was a kind of a trick question because depending on how you ask it, all three of those answers were correct. We identified census measures for these social causes, with the exception of low social support, because there really isn't one, and tested their correlation with zip code level life expectancy in the metro area. The full results are in the report. I can only hit the high spots on this today. But one thing I want to say right away, because I know I'll probably have some biostatisticians and such in the audience. Clearly, I want to say what I've looked at is correlation. Correlation does not establish that one causes the other, but it does establish that when one changes, the other changes in a predictable way. And so they are linked in some manner. So let's talk about what we found. At the very top of the list is education. Across the United States and in fact around the world, the quality of one's health rises in step with education level. The same is true here. Within metro zip codes, the percentage of residents lacking a high school diploma is very strongly correlated with life expectancy. In this scatter plot, you can see that as the percent lacking a high school diploma rises on this horizontal axis, life expectancy falls. And this alone explains about 57% of the life expectancy gap. And of course, I'm sure you know if you live here, opportunities to obtain a quality education are not equitably available to all. And I would refer you in the report to the Child Opportunity Index, a body of work done by another group of scholars that really points out that the opportunity gap here in the metro is worse than in most of the 100 largest cities of the US. Now, next we looked at income, and I'm sure it's really no surprise to any of you that increased income lessens the likelihood of disease and death. But did you know that Indianapolis is among the worst 5 large cities to live if you happen to be poor in terms of your life expectancy? The poor residents of Indianapolis live shorter lives than residents of New York, LA, Chicago, and most of the 100 large metros. And in fact, New York City and LA were among the 5 best cities to live. Now, the income variable that we found to be most strongly correlated with life expectancy is the percent living below 200% of the federal poverty level. And that varies by zip code quite widely in the metro area, from a low of 6% all the way up to 66%. And this variable alone explained 53% of the variation in the life expectancy gap. We also tested an index that you may have heard of called the Social Vulnerability Index. It includes 15 factors, including education and poverty, that we found was also correlated with life expectancy, although it was not quite as good at predicting life expectancy as either income or education alone did. And then the final social cause we spent a good deal of time investigating is racial residential segregation. Now, I want to say here, of course, racism affects health through many mechanisms, but I'm focusing here on a particularly formidable one that comes from the history of redlining that we are still living with a legacy of today. During the late 1930s, diverse neighborhoods were often redlined by the Homeowners Loan Corporation. When inspectors noted and this is literally their term, an infiltration of Black and foreign-born residents in the area. So, these inspectors were sent in basically to look at the area, say, should we give loans for people to buy homes in these areas? And they were given a grade with red being the worst. And if you were in a redlined area, it made it essentially impossible for you to purchase a home, build wealth, and maintain a thriving life in that community. The map that I've shown here is the original Hope map of Indianapolis from that era. And you might, if you zoned in on our life expectancy map, you would see very similar grading coloration, where low life expectancy is concentrated in these formerly redlined areas. And in fact, this has been found to be true across the United States. Studies have shown that residents of former redlined areas have shorter lifespans than those of greenlined areas. Segregation is a really sticky problem. Communities once redlined have a really hard time pulling out of its hold, and it affects virtually all aspects of community life. And yet we've kind of often do not give thought to just how much that's continuing to have an effect. I want to recommend this video to you. We don't have time to play it, but if you really want to see how it is that housing segregation is continuing to affect communities today, this 6-minute video does a great job. So with that in mind, how segregated is Indianapolis? Well, in a national study of the 500 largest cities, Indianapolis was among the most segregated group, who also had the widest life expectancy gap. Coincidentally, in that same study, Fishers, that community I told you about that in our metro lives the longest, was found to be the lowest segregated city with the smallest life expectancy gap. So here again, in our very own metro, we see this vast contrast. Segregation impacts the health of African Americans particularly, of course. Here I borrow from the words of Dr. David Williams, a foremost scholar on the relationship between racism and health, who says, racial residential segregation is the #1 factor driving the poor health outcomes of African Americans today, contributing to the fact that more than 200 Black people a day die who would not die if the health of Blacks and whites were equal. Clearly, this is an issue we must confront if we are serious about health equity. So using the Black-White Isolation Index, we identified the 1/4 of metro zip codes with the highest segregation. Interestingly enough, more than 75% of the area's Black non-Hispanic residents live in just those 21 most segregated zip codes. And of note, this surprised me, but 18 zip codes in our metro area have no Black residents of record. Of course, we had to exclude those from the analysis. What we found was that the average life expectancy at birth among those 21 segregated zip codes was a full 4 years less than the remaining ones. And not only do these segregated zip codes have less lifespan, the percentage living in financial hardship is 5.6 times higher. The percentage without a high school diploma is 2 times higher, and per capita income is $10,000 less. This visualization shows you where those 21 highly segregated zip codes are located and their corresponding life expectancy quintile. You'll notice that almost all of them are located right here in the heart of the city. And there's one isolated zip code up in Anderson. And predominantly these are colored red and orange, which means they're on the low end of life expectancy. So to summarize that body of work, what social factors did we find to be associated with life expectancy by zip code here in the Indy Metro? Education, income, overall social vulnerability, and racial residential segregation are all significant predictors of the life expectancy gap in Metro Indianapolis. These factors often intersect. I think this is getting to one of the question at the opening of the segment. These factors do often intersect in the same geographic locations, constraining access to resources and perpetuating cycles of disadvantage. And what I put forth is that these are social toxins, just as deadly and far more entrenched than COVID. We've gotten so and understandably concerned about COVID, an infectious agent, and that it's affecting the health of all of our populations. But there are social toxins among us that have been affecting and cutting short the health and life opportunities of people long before COVID came along. And so that's what I'm trying to bring attention to here. So main takeaways, let me say, I don't want to be so down on our city, right? Disparities in lifespan that we see here, these disparities exist everywhere pretty much, between countries of the world or between communities located just miles apart in the same city. And the same key social drivers affect health and well-being of populations everywhere. But the size of the gap can be wide or narrow, and it can be altered by societal resources and choices like policies. And there is where we can make a difference. Bottom line, what is possible for the Japanese is possible for children growing up in Fishers, possible for children growing up in Indy's Near East Side. How do we close this gap? I kind of borrowed from some much smarter minds than mine. A group from the World Health Organization issued a report back in 2018 attempting to identify how to close the gap in life expectancy among countries of the world. And they came back with these 3 simple recommendations, which are short statements, but very big tasks. Improve daily living conditions, tackle the inequitable distribution of power, money, and resources, right? That's huge. And then, of course, measuring and understanding the problem. And that's a little bit of what this report was about. There are effective approaches that exist. We've seen that we can make change in the life expectancy gap because there are other countries, other states, other cities that are doing better. Our report provides a few examples of some effective programs that have been tested and recommended nationally, such as high school completion programs for at-risk students, as well as some local initiatives that are active and promising. We have a project going on, an 8-year project going on in Indianapolis known as the Diabetes Impact Project. And it's kind of taking a collective impact approach to trying to address health inequities. So of course, this is a complex problem. No one simple solution to close the gap. This upstream work takes all of us and multiple sectors of society working together. But I believe if we can get our act together and we can collaborate, we in fact can make progress on it. We've seen it elsewhere, and I think we can do it here. That's sort of the end. I do want to acknowledge those who helped me with this work. This was a collaboration between those of us in the Fairbanks School of Public Health and the Polis Center at IUPUI. So I just want to acknowledge other people who assisted, and also point you to a written report that will give you far more detail that is available online. And that's it.
All right, thank you so much, Tess, for that presentation. I'm sure everyone learned a lot. I mean, I definitely know that I did. We do have one question in the chat about how the difference, about how it could be explained that Hispanics who also have low socioeconomic status have a longer lifespan than whites. Another participant in the audience suggested that this may be connected to strong family and community ties in a collectivist social system. But is there any comments that you might have about what that correlation may be?
So if I understand the question, the participant's asking basically why are immigrant communities immigrant or Hispanic?
Hispanic, yeah, I'm sorry, I
Hispanic.
cut the question short a little
Okay.
bit. Originally, he did say it would make sense that the lifespan among Black Americans would be shortest than that of whites because of association between race and socioeconomic status. So how can it be explained that Hispanics who also have a lower socioeconomic status have a longer life expectancy?
Right. Yeah, so there's a lot of really very, very interesting literature around Hispanic, and of course, the whole Hispanic paradox. Hispanic families tend to have a stronger family unit, closer ties to one another that really nurtures them. That social support, those kind of the social dimensions of health end up being very, very important in the Hispanic community. And honestly, I've always said we have so much we could learn about how to promote health from members of the community, our Hispanic members of our community, who I think do that part better. That would probably be my main comment there. I see that question came from Max. Max, have I answered your question?
Yes, and it makes total sense. Yeah, it seems to me that that would be the reason. There have been hypothesized some other possibilities related to, in a minor degree, with probably genetics. But if that is a possibility, certainly is much less determinant than the factor you mentioned. Yes.
Yeah. I find it very, very interesting. They have, Hispanics women have much better tend to have better birth outcomes, all kinds of things. It's a very interesting phenomenon. Yeah. And largely from what I've read, it does relate to the strength of the community ties and the strength of the family unit. Okay, is there another question?
I do have another question to kind of piggyback off this conversation. I was just wondering, like, in areas of low life expectancy in Indianapolis, what community resources you believe that we could leverage in order to improve the outcomes. So for example, you mentioned like social support is very influential, at least in the Hispanic community. Would that be something that you would suggest would be expanded to other areas of low life expectancy?
Yeah, I think that's great. Yeah. So I kind of hinted at a project that we're doing, an 8-year project, and I see Lisa Staten's on here. She probably doesn't want to speak up, but we're doing an 8-year project with 3 large communities in Indianapolis known as the Diabetes Impact Project. But it's not just focused on diabetes, it's focused on improving health broadly in these areas. And what's great about it is that it really does take a collective impact approach where people from several different sectors are working on this together, from community development to healthcare to most importantly, the voices and actions and thoughts and wisdom of community members themselves, right? So we have community advisory groups who help set the direction for how they want, what they see as the issues and how they want to approach working on health improvement in their own communities. So, I mean, I think community empowerment is enormous. Those social connections, building social cohesion, again, that being something that we could learn more from our Hispanic members of our communities. building those strong social connections is really, really crucial. So I would say it's kind of like getting everybody together and listening and working on taking on all these different layers of the problem.
We just got a question of, can you comment on the significance of gun violence deaths and substance abuse deaths for younger Black people and the impact or relevance this phenomenon may have in this discussion?
Yes. Is it Antoinette?
Hi.
Have I said that right?
Yes, that's correct.
So really good question. When we look at life expectancy, the younger that deaths occur, of course, the more it drives down that number, right? So with gun violence and substance abuse deaths being those that tend to occur to people at younger ages, that will really drive down the life expectancy for a community overall if they have experienced many of those deaths from gun violence. Or and of course, I could show you a slide, but I don't know that I want to try to pull it up. Across the United States, deaths from gun violence are way out of proportion to other wealthy nations, right? It's not just Indianapolis, but it's affecting communities across the United States. It's definitely affecting communities here. So for sure, those communities that have experienced a great deal of gun violence are going to have lower life expectancy overall. And the same is true of these opioid deaths, substance abuse deaths, which it was actually the opioid epidemic that caused the first drop in life expectancy of the past decade, with COVID being the second. You know, again, because these are causes of death that occur generally to people far younger than the age of 75, you know, they really will drive down life expectancy a great deal. Are there any other questions? I think it's up to you now, Melissa.
Yeah, sure. We can go ahead and let's get started a few minutes early. Thank you so much, Tess, for agreeing to participate. I really appreciate you being willing to kind of jump on this presentation with me. And thank you all, of course, for participating. We will just conclude our discussion here. It was really great. And I hope you will join us on April 1st at 12 o'clock for our final 2022 First Fridays with Fairbanks event with Melanie Shive and Dr. Bill Tierney. We really appreciate the engagement from all participants, and we really apologize if we were not able to get to your question, but thank you to everyone so much. Have a great day.
Bye.